Hi, Dr. Z over here. So there are a bunch of different regenerative therapies that can be used to treat chronic injuries, chronic pain, as well as acute injuries. A lot of doctors do not know about this, so far less patients. Just a quick background on me. How I came about into doing all of these things was actually by my attending physician who actually treated me for my chronic injuries. So when I was in my 20s, for 6 years, from 20 to 26, I injured my neck and my back. And for 6 years I suffered. I saw multiple doctors, did multiple MRIs, I did a whole body MRI, trying to figure out what was wrong with me. I had constant cricking and cracking in my neck, locking of my muscles, numbness and tingling running down my arms and legs. This went on for years till I was finally being able to be treated by one of my attending physicians. And I continue this practice, and my gratitude is due to him. The majority of chronic pain patients, the reason that they're suffering is due to ligamentous injuries or tendon injuries. Ligaments are bone-to-bone connections. Muscle-to-bone connections are tendons. Ligaments and tendons are like a spring or a rubber band. So, for example, a rubber band has a certain elasticity, and it wants to move around, say, this much. Okay, there's a couple ways you can overstretch and lose its elasticity. For example, you can have a sudden force that pulls it and overstretches it, whether it may be lifting something heavy suddenly and having a sudden pull. It could be a vehicle accident, it could be a tackle, it can be a multitude sort of things. So that immediate overstretch, if you ever looked at that rubber band, for example, you would see a bunch of maybe a couple areas of major deformation, and then you may also see a couple areas of small striations of weaknesses. The other way you can injure is, for example, is that say you had a continuous tension on that rubber band or that spring. For example, you put a bundle of money in a rubber band. Okay, you come back 1 year later, that rubber band is not going to be the same size. Okay, so people who are constantly, we're all on our laptops today and just constantly like this, and our posture is always forward like this. This can cause injuries over time. Okay, now the way you treat these issues is actually through prolotherapy, PRP, stem cells, exosomes, and prolozone. So prolotherapy is the foundation of all of these therapies. So prolotherapy, what it is we're using some sort of hypersclerosin solution to actually create some inflammation. So what that means is when everyone thinks inflammation, they're thinking pain inflammation. We're talking about wound healing inflammation. So for example, when you cut yourself, there's all this the area becomes inflamed, and then there's all this goo that forms there. That is the inflammatory phase of the wound healing. Now you have a matrices phase, then you have a remodeling phase. Okay, so the matrix builds up, and then the remodeling phase where it comes back to normal tissue. Okay, this is what we're doing to ligaments and or tendons. So with prolotherapy, we're using some sort of hypersclerosin solution, such as sodium moreuate, dextrose, phenol, glycerin, something along that lines, where we're injecting it into that area to create some inflammation, to strengthen and tighten those areas. PRP is a little different, and well, actually I'll say prolozone. Prolozone is like adding on like ozone with it as well, and people do get some good results with this as well. PRP is where we're actually taking out some of your blood to get the growth factors, spinning it down, getting the growth factors, and we're injecting it into that area. Then we have stem cells and exosomes. Stem cells and exosomes are like actual seeds. So I'm going to make an analogy here so people can understand this better. Prolotherapy is like there's a patch of area where there's no grass, and all around it there's grass. As long as that grass isn't generally healthy, let's just say, if you put some topsoil in that area, which kind of prolotherapy is in a sense, it would allow those seeds to sprout and heal that area. Okay, now PRP is a little stronger. Say it's like topsoil and fertilizer, right? So say there's some of the grass around it's not as strong or whatnot. PRP is like having a little fertilizer. It would spruce up the grass and the grass seeds around it to actually and then create the area that is barren to be to grow some grass. And then the last is stem cells. So stem cells and exosomes are a little different. These are like actual grass seeds. And exosomes, it's not exact correlation, but it's like the nutrition pod or the grass buds that come out from the seeds. Okay, so say there's a bunch of barren land. Okay, and no matter how much topsoil fertilizer, because there's not going to be enough grass patches to kind of get those areas healed, you would actually have to use some grass seeds. So in this case, what you're doing is you can add the grass seeds with some fertilizer and topsoil and whatnot, and it would actually spruce up that area to actually regrow the tissue, okay, better as from before. So I'm going to show a few examples here. So this is a patient's neck. Over here are the vertebral bodies, okay, these are big sections over here. In between these sections, you have the discs, okay, so when people talk they have a herniated disc or whatnot, that's what they're talking about here, and it causes a bulge, okay. Over here is your spinous processes. So when you feel the back of, the middle of the back of your neck, this is what these are, okay. Now, over here, there's these facet joints right here, okay, and they have a little capsule, a little articular capsule, which is that ligament that I'm talking about. It's like that allows this bone to work on top of this bone. And what this facet does, there's one on the right, on the left. What it does is it allows this vertebral body to move on top of this one, okay. So if you turn your neck or whatnot, these have to be in motion and do allow some movement, okay. Now, you'll see these holes here. These are the foramens, okay? Your spinal cord runs down the center. Same thing, one on the right. There's a hole on the right, one on the left, okay? So this is the right view. This is, so you're going to see your right, and then there's one on the left, okay? Now, a nerve root comes out of each one of these. So let's look at this patient. He's going to extend his neck back. Now, let's see what happened. You can see that it closed up. So this foramen got completely closed up. So it's compressing on that nerve. So when people are complaining of muscle spasm, neck tightness, tingling numbness down arms, legs, neck, whatever, headaches, it usually headaches more up top. But even still, these are all things that are stemming from these areas of the ligaments and the tendons not being able to perform properly. Okay, so this is what happens. Now this patient got around 4 treatments of prolotherapy, so let's kind of go to this section. So we'll have this patient, he will be flexing forward, and then he'll be extend back, okay? You can see a vast improvement, okay? A vast improvement that these foramens are opened up much more than before over here, okay? So you can see these are not that clearly open versus over here, much more open, okay? And this is what you're actually treating the outside. You're not going anywhere near here, okay? You're treating the outside, the ligaments and tendons on the outside, okay? The facet joints, the transverse process. This is Dr. Greenberg over here. So you'll see he's injecting PRP into this patient's neck over here, and you'll be seeing that he's not using any ultrasound. He's going down to the sections one by one into each one of the facet joints very carefully, and you'll see a lot of doctors who actually do this will use a Hackett-Hemel approach, which is what this is. So instead of using ultrasound to just pinpoint things and do things one by one, and a Hackett-Hemel is you're treating the complete area, which I've gotten treated both ways, and have gotten much better results doing the Hackett-Hemel approach than with any other approach. And this is what I use for my patients as well. This is Dr. Ongley here. He has treated the U.S. ski team before he passed away for years. And you'll be seeing he's treating the PSIS on this patient, where a lot of ligamentous attachments attaches down here and whatnot. So he's treating this patient thoroughly, doing the same thing, Hackett-Hemel approach to treat this patient as well. Here I practice what I preach, and you can see here, this is me receiving some PRP, and I'll also be receiving some prolotherapy in my neck. I've been injured in my neck and in my back, as I have stated, and this has kept the tingling, numbness, no pain, and it's been a tremendous, tremendous help to me, and as well as to my patients.
Post prolotherapy, this is before prolotherapy. There's a little arrow there pointing to a blackened area. That blackened area indicates a tear. And this is after prolotherapy, and you can see that, I'm sorry, it's a mottled area. Excuse me, that was my faux pas. But that little mottled area over there, that whitened area, and you can see over here it's all blackened in, and so that means complete healing. Next, we have his ACL, a very common tear, anterior cruciate. You can see this mottled area here under the lines, and then afterwards you can see a nice black streak in there, and completely healed. And his posterior cruciate, which is not really used a lot in normal functioning, but people who wrestle and do active sports and stuff like that need it. And again, here's this area here, all mottled, and again, after treatment, again, only 6 treatments done about every 3 weeks apart. You know, if he had had surgery on this guy would have been out for 6 months to a year, minimum. Maybe even longer. Okay, here's a meniscus tear pre and post. Okay, this is an ultrasound, which is done a lot. You can see these 2 holes here in the meniscus here, and then afterwards, basically almost completely healed. So these pictures show it all. This one, I titled "The Picture is Worth 1,000 Words," but they're all worth that. This is actually a reverse type of MRI. So the whitened area you see here is a tear in the posterior horn of the medial meniscus, one of the most common torn ones, and that's why getting an MRI sometimes is not worth it, because many of you out here probably have it and have 0 pain, and you certainly don't need surgery or want surgery. But again, after being treated here, you can see that whitened area completely healed up. So we do have proof. There is pictures, okay? Here's a ruptured disc case. Okay, this person said you need emergency surgery. He was in the ER. If you don't, you're in great danger of paralysis and bladder and permanent damage. MRI, you can see that big gap there in the posterior longitudinal ligament, and over here pushing back where the disc is pushing back. After prolotherapy, you can see the ligament nice and smooth and healed, and again here, nice and smooth and healed. So the reasoning behind this, because we do not inject directly into the spine or into the disc, so how can this happen? Okay, number one is tensegrity. Tensegrity means the tension in the entire area. So we're treating everything around that area to give it support, to give it strength, to be able to hold that load, hold the vertebra apart, and then allow for all the weakened areas to be treated.